Bismillahirrahmanirrahim and Assalamu alaikum and welcome our other guests also. Today this medical event is educational and creating awareness regarding physical illnesses. Like we care about our spiritual health, psychological health and emotional health and financial health, and at home relationship health with their wife, we need to keep peace. Similarly, the physical health is also extremely important. Let me introduce our speaker today and the team who is accompanying him. Dr. Asif Raza, he is a surgeon, urologist, and he works in Ealing Hospital and Northwick Park Hospital with the trust, London Northwest Healthcare NHS Trust. In his family, his mother has a kidney failure, his uncle and brother-in-laws, the young brother also had a kidney failure. So his interest in the kidney disease and illness and prevention and treatment is also have a very special significance. He himself mentioned that he is not a transplant surgeon, but he works very closely with all the transplant surgeons, kidney transplant surgeons, and or to do with anything, any illness or disease with the kidneys. And he will explain why kidney health is important, while drinking water is important, while our body and health is important. And he will provide this information to you, and it is awareness. So the most important that we do our khutbahs and talks to create awareness. So this is like a kind of awareness. He is supported by today West London Kidney Patients Association, and I feel very proud and honored that we have people from that charity, and they are personally here, and their manager is Penny. Can you just stand for a second, please? And this Penny, thank you very much. And Sarita is also working for the charity. And we have a very young supporter for the charity and her father, Asif Raza. Stand up, please. So she's come to support her father. Please take a seat. And it's extremely important, father and charity. So I think we hope and pray that our children, and especially also these young children, mashallah, is excellent. I will ask your parents to please give you a very good gift today. If they do not give you a gift, then you come and complain to me tomorrow, okay? Because you are sitting here, you came here, that is excellent. All young people. So I hand over to Dr. Asif Raza. And in the end, if anybody wants to ask any questions in English or Urdu, Dr. Asif Raza speaks Urdu in Scottish accent, doesn't matter. It is understandable, it is fantastic. Or I can translate if need arises. And I'll also encourage sisters and brothers, if you got any direct question to ask from Sarita and Penny, who have kidneys which belong to other people, that means kidney transplant patients. David is here, I have not introduced him. My apologies, he's also part of the charity, and he's on dialysis. He's on a waiting list for kidney transplant. So these wonderful people who are helping the public, the humanity, and that's why we are bonded together. No boundaries of faith or religion or anything. This is the humanity work we're doing together. So may Allah reward all of them. Over to you, Dr. Asif.
Assalamu alaikum, brothers and sisters. I would like to thank, first of all, Dr. Zubair Chaudhry for his help and support in organising this event, and the mosque committee. Thank you very much for allowing us to attend today and try and help with education about kidney failure and kidney transplant. I'd also like to thank West London Kidney Association for coming. Their time is, as everybody's time, is very valuable. I would like to make this discussion interactive. Joe, I'll try and speak in Scottish Urdu as well. So inshallah, जो किसने मुझे क्वेश्चन पूछनी है, प्लीज़ आप उर्दू में बात करना और अंग्रेज़ी में बात करना. मैं स्कॉटलैंड में पैदा हुआ था, सो मेरे लिए अंग्रेज़ी ज़रा इजी होती है, बट जो भी आपने पूछना प्लीज़ पूछो. ये talk होगा, मैं शुरू कर लेता हूँ talk, but please, if you have any questions, please don't feel scared to interrupt. The more interactive this session is, the more better it will be for everybody. And as we've said, we've got David, Sarita, Penny here. They can answer any questions. Can you raise your hands if you have anybody affected by kidney failure in your family? Anybody? Okay, 2, 3. Okay, so that is quite a small number. Normally, in the Asian community, it's a lot higher. Asian community in particular are at risk because of various issues which I'll discuss today. So 2 or 3 people being affected, I'm pleased about that. But if you ask questions of your friends and your close ones, you'll probably find is a much higher number that are affected. Okay, so inshallah I'll start my talk. Please feel free to ask any questions if you have. So, just disclosure, I'm a member of West London Kidney Association. I just joined recently, and again because my mother is on dialysis, and previous family members have been on dialysis, is very close to my heart. Just some basic education. I had medical students nowadays who don't know where the kidneys are. It shocks me, but this is sometimes a level of education. So the kidneys are located here. Does anybody know what the function of the kidneys are? Can you tell me? Anybody? What do the kidneys do? Okay, we'll talk about that. But the kidneys, they're not at the front. Usually, they're posterior. And we have 2 kidneys normally. Some people are born with 1 kidney. Some people are born with kidneys joined together in various places. They can be in the normal place, they can be in the pelvis. So there are many variations of the kidney. And you only need 1 kidney to live a normal life. Okay, so people worry about giving a kidney for transplant or organ donation. But an interesting fact is, if you're healthy and you give your kidney to someone, you're more likely to live longer as the donor than somebody of your similar age who's not donated a kidney, because you're well looked after your donation. People will take care of you, your blood pressure, your sugar, everything is monitored regularly. So those people who donate kidneys in general live longer than the general population. Okay, so interesting fact number 1. What do the kidneys do? They remove waste products from the body. So waste products are generated by what we eat, by what we drink. The kidneys are filters. They filter the waste products and they produce urine. Urine, does people know what urine is? Okay, I don't want to use the term in Punjabi, but urine is filtered by the kidneys. So they're like we filter our water. Similar, the kidneys do a similar job. Okay, so they absorb some products, they excrete some products, salt, sugar, various other proteins. They remove drugs from the body. They balance the body's fluids and release certain hormones. They produce an active form of vitamin D that promotes strong, healthy bones. And they control the production of red cells. So the kidneys, as any organ, are very important, but luckily Allah has given us 2 kidneys and we can live with 1 kidney. So we can lose 1 kidney. We only have 1 brain, we only have 1 heart, but we have 2 kidneys. Okay, so yeah, we can live with 1 kidney quite healthily if that kidney is healthy and you're healthy. What causes kidney problems? You can present in 2 different ways with kidney injury. You can present with what we call acute kidney injury, is where something happens suddenly. This may be an infection, it may be blockage to the blood supply of the kidney. These are acute, sudden onset problems. And patients often end up in the hospital. It could be I'm a kidney stone specialist. I deal with a lot of kidney stone patients. जो किडनी पत्थर होते हैं मैं उसके साथ deal करता हूँ. And sometimes kidneys can block the kidneys, stones can block the kidneys and cause infections, and sometimes lead to kidney damage. We have chronic kidney injury. This is a long term. So acute kidney injury, usually you can resolve it. So for example, if you have vomiting or you have diarrhea, what happens to your body? You lose the fluids from your body. You become dehydrated. Dehydration, if it's significant, we all know, if you've been to Pakistan or India or other warm countries, if you get food poisoning, you become dehydrated. What do? You supplement your fluid intake. You take water to keep your kidneys replenished, okay? If your kidneys become dry, they can become damaged. So it's very important to keep the fluid intake. So that's very important for us. So acute kidney injury, infection, dehydration, usually we can treat that and resolve it. Most people recover from the acute kidney injury. So doctor will give you fluids, doctor will stop the tablets which may be causing the kidney injury. Does anybody take painkillers here? Anybody take painkillers? You can raise your hands. Do people take Nurofen or Brufen or any non-steroidal tablets? Do they know the ones? Cocodamol. Okay, so Nurofen and diclofenac, these are called the non-steroidal tablets. These are more harmful potentially to the kidney than other tablets. Okay? Cocodamol has codeine and paracetamol. Not so harmful to the kidney, okay? But the ones we have to be careful, and unfortunately my mother was prescribed a lot of, because she had arthritis, she was prescribed a lot of Nurofen and Voltron, and this, with other issues, caused damage of her kidneys. So you have to be very careful about this type of medication, particularly if you have other issues like diabetes or high blood pressure. It's very important to speak to your doctor and say, look, is this going to damage my kidney? You should not be scared of your doctor. You should not be shy of your doctor. As Dr. Zubair Chaudhry said, we are humans. We are here as humanity to help each other, okay? So people who are sometimes very scared to ask the doctor a question, don't be, okay? Don't be. Because doctor is simply a patient of the future as well. I call myself a patient in waiting, okay? My time will come. And then we have end-stage kidney disease. This is when the kidneys are failing. And then this is difficult to reverse at that stage. And then, you know, my kind friends who are here can tell you some of their experiences perhaps of dialysis and transplant, whereas I only have my experience of my parent and their experience. So you can see here the diagram. These are the kidneys. The kidney has two tubes which run from the kidney to the bladder. The bladder is here. In a man, you have the prostate, and then you have the urethra, which is like a right for the sorry. Hello, hello, testing. Maybe this one is stopped. Hello. Can everybody hear me? Yes, that's fine. I prefer to speak like this rather than through the microphone. So you have these tubes here which run from the kidney to the bladder. These tubes are called the ureter, and this takes the urine from the kidney all the way to the bladder. And the bladder is basically like a storage vessel. The urine collects in the bladder, it fills up, and when the bladder is full, some receptors send messages to your brain to say, please go and empty the bladder, okay? So that time you go and empty your bladder when it's socially convenient for you to empty the bladder. When people have kidney disease, it affects usually the meat of the kidney, the outer surface of the kidney, okay? This is the part which normally gets affected. Although if you have blockage in these tubes, blockage of one tube in particular, you can still have normal kidney function, okay? Even if one tube is blocked. If both tubes are blocked, you cannot have normal kidney function because eventually the kidneys will not drain. In men, the prostate here can affect the emptying of the bladder, and some men can get pressure onto the kidneys.
And then you can get kidney problems from the pressure, back pressure. Not every man with prostate problem, some men, okay? I'm a urologist, so I deal with a lot of people with this type of issue. Younger children, we got 2 young boys, mashallah, one there. We got a young daughter here. Children, probably less boys, but more girls, they sometimes are afraid to go and empty their bladder because they're shy to go, from the classroom or anywhere, and their bladders can become very overfilled and weak eventually. So if you have daughters, boys usually not a problem, but daughters, tell them to go and empty the bladder regularly. Don't hold on. There used to be this term, it's a very, probably not what we call politically correct term anymore. Camel bladder, they used to call it, camel bladder. Why camel bladder? Because people, they hold on to the urine for too long, like a camel. And then what happens is, you can get infections and you can get problems. So the key thing is, empty your bladder regularly. If you can hold on for every 3 to 4 hours, hold on for 3 to 4 hours, then empty your bladder. At night time, obviously, if you can go to sleep, please sleep. I'm not encouraging anybody to get up. I was up at 3 o'clock in the morning today, and it makes you tired. So if you can go to sleep, try and go to sleep. Anybody have any questions so far? Please feel free to
Can you
ask.
just explain that thought about emptying your bladder regularly?
Yeah.
Is it every 3 hours at least?
Yeah, so every 3 to 4 hours,
Yeah.
because your bladder, most people's bladders hold a capacity of 500 mils, 500 milliliters. And if you drink coffee or tea or water, after everybody's bladder may be a slightly different size, but generally 500 mils. And your bladder fills up at a constant rate normally. And when you start to feel pressure, you go. If you're not feeling any pressure, some bladders, they have no sensation. Their sensation is not good, it's affected. So you can have a bladder with 5 liters in it and not know. Okay? I've seen men come to me who are like pregnant ladies. And their bladders are up to here, this size. And they don't know because the sensation of the bladder has gone. They may be only going past urine once or twice in a day. Oh, doctor, I feel wonderful. I'm 80 and I only go and pass urine once a day. It's wonderful. All my older friends are going 15 times. As well, that's more normal, 15 times than once. So, because the bladder is overstretched. So very important, remember that the bladder, it can affect the kidneys as well.
How long bladder should take
To fill and empty? Well,
they have demand?
in a healthy individual, again, it depends on the kind of fluid you're drinking. So for example, if you're drinking coffee or tea, which is diuretic, has caffeine in it, it will fill much more quickly. And you will then want to go much more quickly. As you get older, the bladder capacity, the bladder shrinks in size. So you have less tolerance. You have to go more regularly.
And it is other than this one, any illness causes fill up?
Yes, so if you get recurrent infections in the bladder, ladies are more prone to infections in the bladder can then shrink. For example, somebody's had bladder cancer, we may give treatment into the bladder can shrink. Some people are born with smaller bladders. But in general, it's infections, repeated infections, which can cause it to shrink.
You say you got the blockage of the tube, urethra.
Yes.
The symptom are the same as something wrong with the kidney, or the symptom are different?
So it depends.
If you do the operation, like if you know like the tube is blocked, so that's the same operation as for the kidney, or that's like a easy one?
No, so yesterday I was operating on some lady with a stone, and her stone was here. And it was causing partial blockage of the kidney. Her kidney function blood test was normal because her other kidney is producing. She said, doctor, I'm passing normal urine volumes, normal amount of urine, so I must be okay. I said, well, one kidney is partially blocked, but the other one will increase its urine production to compensate. So the amount of urine you produce sometimes has no bearing on the level of obstruction. My operation for her was to put a telescope up here, put a laser fibre on the stone, break the stone, and then put a tube in here to drain the kidney. So, and I will take that tube out in a few weeks' time. I did not have to do anything to the kidney, just the pipe which drains the kidney. It's like simple plumbing. I'm a plumber. I'm a physiological plumber. Yes? We have cardiologists who are like electricians, and Dr. Chaudhry is a master of everything. So sorry, which way? Okay.
There are so many plumbers out there.
Okay. So thank you. So yes, I'm a plumber, and so what about kidney failure? The stages of kidney failure. You have stage 1, stage 2, stage 3, stage 4, and stage 5. And stage 5 is usually when the kidney function is less than 15%. And then usually, again, I'm going to ask David, Penny, Sarita to maybe make some comments in a bit, once I get a little bit more into the kidney failure side of things. But in general, stage 1, we don't normally do anything to treat. It's prevention. I'll go into these, but stage 2, stage 3, again, a lot of this is dietary, medication, lifestyle. Stage 4, you're getting to the stage where you may need dialysis. Stage 5, when the kidney function falls below a certain level, you will need dialysis or you go to transplant. So people might ask, and I'm going to ask Penny, if you want to come, do you want to come up here, please? Penny, David, Sarita, please come up. Because all I can do, yes.
When it gets to stage 1 and stage 2, why do they leave it for it to get to stage 3 and stage 4? Why can't they tell the patient
So they should
about
be.
diets?
They should.
So it doesn't prevent it getting worse.
Absolutely. Okay. This is what should be happening, right? So education should be happening. A lot of the GPs are not aware of these things. There are guidelines, and then from National Institute of Diabetes and Disease for Kidneys, from NICE, which is the National Institute of Clinical Excellence. There are renal guidelines, and they will tell you. But there are so many guidelines that some doctors don't know. So this is where these talks are very important, for you to know that you have to take some responsibility for yourself. You won't know, obviously. If somebody says to you, you have stage...
responsibility for yourself, and if it's stage 1 and the doctor hasn't told you anything, you don't know what to eat.
Yes,
so maybe you get stage 3, or you might be...
Yeah, so, if you go in and you have a blood test, normally it's picked up by a blood test. And I've not put the blood test levels here because I thought it might get too technical. But you should always ask your doctor. Doctor, he says, oh, your kidney function is slightly abnormal. Doctor, tell me, stage 1, stage 2, stage 3, stage 4, stage 5. Sorry?
Color of the urine.
Color, no, not so important. Not so important, but more the blood test from the GP. The symptoms, I don't know any of the symptoms apart from the symptoms my mother had. And when she unfortunately, I was in London, she was in Glasgow, and it was only when she came to London and she had a shoulder problem. I took her to see a shoulder specialist, Dr. Zaman, and we did blood tests and we saw that her kidney function was reduced. Then she went back to Glasgow. She met some of I pushed for her to be seen by a renal physician, and then the renal physician said, look, and Penny, Sarita and David will be able to tell me, but he said your kidney function reduces by approximately 7, what we call GFR 7 by each year. So if she was on 35, she said, doctor, my mother is going to require dialysis within 4 or 5 years. She said, yes, she will. I said, why did you not do anything earlier, to reduce her weight, to give her advice? And we told her, but it's very difficult sometimes with your parents to get message across. So inshallah, we can try and do this. But so David, Penny, and Sarita are going to tell me what symptoms they had. David, I don't know, you don't have a mic, so Do we have a mic for
Just a quick clarify.
Okay, so can you tell what symptoms you had?
Well,
It's a question, okay.
Okay.
Quick question?
okay, I think you have sort of read my mind. I would just like to ask one of them, anybody can volunteer, that when they, now in hindsight, when they reach the stage 3 or 4 or 5, how did they progress from stage 3, 4 and 5? So that will be very beneficial for people to know that that is the time where the disease might be reversible. So can one of you sort of remember how did you reach to stage 5, and if you can take us through from stage 3, 4 or 5, what would have been done? Very briefly, if you remember it.
Well, hello. Basically, I started off with high blood pressure, but in the Afro-Caribbean and nations, they don't really know that they have a lot of high blood pressure. And my job, I'm a chef by trade, and that's how come my girlfriend at the time said, oh, you need to go to the doctors because you've got high blood pressure. So I went to the doctors and they said, oh, right, you have only one, you're functioning on one kidney. And I thought, ooh, that was a bit weird. Never knew that one. And basically, they told me that I'm going to have renal dialysis. I think I was about stage 2. I was at 31. And they said that basically I'm going to have to change my diet, try and cut down a lot of other stuff, and that sort of thing. It was kind of like weird in a sense, but I'm alright now. Not too bad.
So apart from the blood pressure, have you had any other symptom like which you felt, oh, it's a problem, I had pain or maybe weakness or something?
Oh.
That's why you went to the toilet?
Yes, going up at, like the doctor said earlier on, getting up at night time, going to the toilet a lot, and fatigue, very fatigued. That was the main thing, because I was thinking, oh well, I'm getting up in like 2-3 times a night, going to the toilet. Don't really think of it really, and when you're working, you know that you can work at a certain pace. And when you feel that, oh, I could have done this better, you're thinking, and then you like, it doesn't really, when you're busy, you don't think of it as you're getting tired, or you're not getting enough sleep. But it all breaks down. When you look at the ends of it, there's jaundice, that's level 5. There's jaundice, slurring your words. There's a lot of things when you get to stage 5, which I didn't realise until my doctor said to me. Basically, I collapsed out at work, and then the doctor went to my doctor, and he said, well, you only got about a week to live. And I thought, wow, really, wow. And it did hit me really hard, really hard. But everybody's got different, Sunita and Penny's got totally different experiences.
Just my experiences.
Yes.
How you came to
How
when
I
you
came-
when you were at stage 3, 4, and 5? What were you told to try? Well, stage 3, what were you told to try and minimise the risk of you getting to stage 4, stage 5? Or were you at stage 5 when you
I
were?
think my biggest problem was I worked full-time, a lot of hours. I worked for the council. I was in a high-pressure job, so therefore just work. And any symptoms I got, I just ignored them. So therefore I was sort of stage 4/5 very quickly. I didn't actually know it until I got to 4 or 5, so I was very tired. So I was working, so therefore my association of being tired was about work. So yes, I was, suddenly my legs started to swell up, my ankles were swelling up one Christmas. I was determined not to spoil Christmas for my children, so therefore I worked through it. But by Boxing Day, I was admitted to hospital because my feet were double the size they should be. And then they realised that I was seeping, I can't get the right thing now, seeping something from my protein, that's it, yeah, seeping protein. So it got really bad. And then I was in hospital for a week while they sort of worked out what was wrong. And basically, I was already there. I was, sort of what happens there. So I didn't really have a lot of time from the time I was diagnosed to the time I started dialysis. It was about a year, but yes, they did tell you, change your food, try and keep the blood pressure down, try and stop working long hours, and try and rest. But yes, I didn't have long before I knew that I was going to be on dialysis, so mine was very short and sweet.
I was losing weight for a number of years, for 3-4 years. Suddenly, within 6 months, I lost about 20 kilos plus. So that was a drastic weight, and I was quite happy with myself because I lost weight. And I was working full time, just like Penny, doing very long hours, sometimes working 6 days a week. And I had a nail infection, so I went to see my GP after work. And he took some blood tests, and I told him I got a bit of bruising on my legs, and they were like big bruises, that big, and I had no clue. I thought I was just overworking, not eating well, looking after my young family. And that same evening he called up saying your hemoglobin is low. So that led to me being diagnosed for various things from head to toe, going through oncology, that's the word, is it, for cancer and all that. Finally, I was sent to renal clinic to see what was wrong with me. That is where it was diagnosed I have a renal failure, my kidneys are failing. They initially told me within a year I'll be on dialysis. But within 4 months I was on dialysis. My creatinine just kept creeping up. So I had no symptoms as such. I had high blood pressure, but it was controlled. I was on medication for that. I just kept losing weight. And my hemoglobin dropped. That is the only thing I know. There was no stages like stage 3, 4 or 5 or whatever it is. So the only time it was diagnosed was end stage renal failure, and that is where I started.
Did they tell you like what was the problem or what caused you the failure of your
They did a biopsy on my kidney.
Yeah.
And biopsy didn't show anything. It just said it's so badly scarred that they cannot figure out what caused my kidney failure.
Okay. And Penny, you were one, like you mentioned, the pressure and the work on. Were you using any painkiller at the time, which could cause like?
No, unfortunately, well, fortunately, I don't know which way round, yes. No painkillers at all, just working hard. Anything that I was suffering, I just ignored, unfortunately, and we're now here to actually don't ignore it. If you actually feel tired or you feel anything, go to your doctors, get tested, because, as I said, I just totally ignored it. And I, like Sarita, was very close to end stage very quickly. I didn't have any time to change a lot. So, yeah, that's why we're here. We're here to tell you, go to your doctors.
Another symptom I had was I was getting cramps in my legs.
Oh, yeah, cramps, yes.
Cramps are very common if you're having a kidney failure. I don't know why.
Yeah, cramps, that's very
Cramps are very common. So I was having cramps on my legs right there. There were times I would have a cramp climbing up the steps. And before you could steady yourself, you'll have cramp on the other leg.
Yes.
So I was in tears very, very often. If I had a cramp, I would jump out of bed at night. By the time I jumped out, I would have cramp on my other leg and I'd be on the floor because I couldn't stand up. Look for weight loss, look for anything that's not you. Get your blood test done on a yearly basis if you can. I think that is what I would suggest. Go to your GP, it's like an MOT for your car. Get your complete blood test done once a year. And if there is any high, I don't know how to say this. I didn't have a very good GP. My creatinine was rising, but he kept saying, oh, it's okay, it's okay, it's okay. I wish I had been more knowledgeable and more proactive and seen through my tests to see, oh my God, this is rising, I need to do something about it. That went on for a number of years actually. It's a very, very slow disease. It doesn't come overnight. It's a matter of few years before you realize, oh my God, I am going towards kidney failure. It's a very silent disease.
Question for the three. Did you feel any pain at the position of kidney?
No.
Oh, I did.
Okay, so we've got 2 no's and a yes.
I did.
Everybody's different.
Is it usually the pain is due to stone in the kidney? insurance?
I don't know.
You can,
It's,
no.
no, I just got pain. I just had pains in the back, but you know, all it is was just aches and pains, and I, like Penny does, I ignored it.
Okay, doctor, from the kidney function test, can anyone receiving the figures can say if it's stage 1, 2, 3 or 5?
Yeah, so the doctor will do the blood test, and depending on the level of the creatinine, then they can say whether it's stage 1, stage 2, stage 3. That's a blood test, simple blood test.
So,
Okay.
I think he's asking, can you ask now? So if you had a blood test now, could you ask your GP now?
Oh, yeah.
Yes.
You can ask your GP any day for
Of
the
course,
results.
you can ask, you can go and say, doctor, I'd like a blood test. You know, if they refuse, then you ask them, why are you refusing, okay? And again, sorry, yeah, just don't be afraid of your GP. Doctors make mistakes as well, okay? So just be.
Just want to ask these three, after having these problems, now looking back, what do they think? I mean, what were the reasons? I mean, were they sort of, as they mentioned, just overworking, or was it actually some side effects to some medication they were taking, or was it food? I mean, what they were told by the experts.
Yeah.
So I think David said he had high blood pressure, and I'm going to go into some of the causes of high blood pressure, okay? Penny, I'm not, it was a high blood pressure for Penny. And Sarita?
I had high blood pressure.
High blood pressure, okay, so there you go.
But it was being controlled.
Yeah.
I was on medication.
Yeah.
But I was thinking I'm working overtime, like literally long hours with a young family, so I was just losing weight.
Yeah. So you can see very common theme there, high blood pressure. I'm going to go into a little bit more of the causes. I don't know how we're doing for time, Dr. Chaudhary. Oh yes, sorry, please.
I'm suffering from quite some time, the pain on both sides. Sometimes only one side, but occasionally both sides. I've been told that I have a kidney stone. They have removed the kidney stone after a long time, after 6 or 8 months. But I still have that, keep having infection, breathable. I'm still on a lot of antibiotics. Many antibiotics is not working on me because of, I don't know what the reason. The only way they can treat me to take me hospital and do IV, you know.
Okay.
So what is the cause of this? I don't know.
Well, the thing is, you're seeing a urologist, okay, somebody like me, but you're seeing a urologist. Infections can come from the bladder, the prostate, the kidney. If you have a stone in the kidney not causing any blockage, unless it's a very big stone, usually doesn't cause infections. Sometimes it's due to what we call the lower tract, the bladder, and the prostate not emptying properly. So you need to get bladder scan to see if you're emptying your bladder properly, because if you imagine a puddle of water on the ground, it gets dirty, doesn't it? It gets dirty. Stream of water stays clear. So if you're not emptying your bladder properly, potentially it's a source of infection. And if you keep on getting resistant infection, sometimes the thing, if you're not symptoms, is to not treat it, is to clear itself, okay? Because if you give more antibiotics and more, sometimes you get worse infections. As long as your symptoms are not too bad, as long as you're not getting fever or temperature, then sometimes it's safe to avoid. But you should see, I can't give you specific advice because I'm not your doctor, but a bladder scan is very useful to see that you're emptying your bladder. It may not be your kidney stone that's causing all the infections.
Doctor, if there is blood in your urine, then that is indicated.
Yeah, well that needs investigation, okay? Because a lot of kidney disease will end up with blood in the urine. I don't know if David, Penny, Sarita probably have blood in the urine. And in kidney failure in particular, you have protein, because the kidneys cells, they have a certain size, and when the kidneys are damaged, so the openings in the kidneys become larger, so the big molecules like the proteins can leak through. So if you see a lot of protein in the urine, it's more likely that your kidneys are damaged. Blood in the urine, if it's visible blood, then you have to have any blood in your urine at your age. You have to have investigations, scan of the kidneys, look inside the bladder potentially with a telescope, So any blood in your range, okay? But there can be different causes for blood, stones, infections, prostate, kidney disease, tumour, cancer. Okay, so it's something to definitely see your GP about. I don't know what, yes, please. Okay, so please, yes.
You know the doctor said to me I had protein in my urine?
Yeah.
But when you go to the toilet, your urine is frothy. So that's the first sign.
Yeah, that's one of the signs. That is a
One of
sign.
the
Yeah,
signs.
sorry.
That's one of my
Yeah, that was one of the
Yes,
signs.
that is one of the signs. As I said, I probably had that sign. I think I did have that sign looking back, but did nothing about it. So yes,
I
that
went
is
to
one.
my doctor straight away, but he just kept giving me medication. And I said, is there anything I can do? He said, no, just keep an eye on it. There was a chart, it was going like this, but it was going up.
Did you have your blood test done?
I have everything.
Yeah, you need to have your blood test.
Get your pregnant test
Blood
done.
test.
I think you need to have your blood test done.
High blood pressure, but after I was on dialysis, 2 years later...
You had dialysis?
I was on dialysis.
You were on dialysis.
After 2 years, they said...
You should be
they said it
joining
was
us.
lupus.
Oh,
They
lupus.
said it was,
lupus, yes.
after
yeah.
2 years, they said it's not high blood pressure, it's lupus. So how did they get that wrong?
Well, the thing is,
I'm sorry.
doctors are only human,
I know,
okay?
I know.
And we make more mistakes than we get things right, okay? If you look at reality, okay? Somebody said to me, which hospital would you rather go to? One which has a high mortality and high morbidity rate, or death rate and complication rate, or one which is a low one? Well, who would rather go to one which has a low complication rate? Take your hands up. Who would rather go to one with a high one? Okay, the reason you go to the one with a high one is because they're honest about reporting their complications, okay? So that hospital, actually, well, the doctors there are actually being honest about what goes wrong. Every hospital has complications, okay? And the hospital which has no complications, you have to run away from it, okay? Because they're not reporting their problems. Yes, obviously if it's North Staff, Mid Stafford, you want to try and stay away. But generally, a hospital who reports their complications is generally safer than somebody that doesn't report. Okay, it's a slightly strange way to think about it. But I'm way of time. Sorry, Dr. Chol.
Just I think regarding time, at 2:30 we will have call for the prayer, adhan. If we don't finish, then we can come back in 20 minutes time.
Okay.
The prayer will be 2:45. I just want to ask the audience and people who are here, if anybody wants to ask questions in Urdu, if they don't feel comfortable in English, please do ask. Don't just sort of, sit down and feel anything different. You're most welcome to ask questions in Urdu.
जी उर्दू में बात कर लेना प्लीज़ जी आपके पास क्वेश्चन है आप ज़रूर मुझे पूछना मैं कोशिश करूँगा उसको आंसर करने के लिए ठीक है Scottish accent maybe so I'm going to carry on just now Penny, Dave and can you take us oh yeah, sorry
So I just want to say thank you for sharing your cases with us. Would you be able to share with us what lifestyle changes you've made after your dialysis? So you've taken up the dialysis point.
I'm still on dialysis.
You're still on dialysis.
And I still work.
Right.
So being a patient, being a dialysis patient and being a renal doesn't stop you from working. You can still do it everyday life. It does affect some people, but you've got to try and focus your mind and think about it, that you've got to live.
But what changes have you made to your life after that stage now?
It's been a kind of like a learning curve and high and a low. It's, I've had to cut back every year. I try and change everything because if you try and change something straight away, it's very hard. So I try and change everything, cut down stuff that I don't take last year to every year. I keep on changing everything.
If someone is on dialysis for a long time, can he come off from dialysis?
Only if I get a transplant and I've got a red blood group and I've been doing it 19 years. So it's...
We both had transplant. I had
They
it
both
after
had
10 years on
transplants.
dialysis. So I did make changes when I was dialysis, but when I started, maybe like you started 19 years ago, there were a lot of restrictions. There was more of you can't have this than what you can actually have. So we just had to change around it. But then because I had controlled my intake of food, I could eat, well, not everything, but practically everything in small portions. So now things have changed. You are allowed to eat. Unless your blood tests show you differently. Every patient is different. Every patient. No 2 or 3 people will have the same diet and have the same blood test results.
Are you changing dietary then? Or are you
Dietary changes, and they encourage you to exercise. Because in my case, I lost my muscles. So because I was on dialysis for 10 years, when I went up the steps or down, I had to hold on to something for support to go climb up and down. And losing muscle is a big thing on dialysis. I think it's very common. It's massive. And it's funny how after a transplant, it just revives. It's like a different life altogether. But again, we have to have restricted intake of food even after transplant. Because firstly, suddenly you have your appetite back and you're allowed to eat everything that you said not to have. But it's so easy to gain weight. And gaining weight after transplant is not good for your kidney. So it's such a vicious circle. So then you try and lose weight.
Is dialysis painful?
No.
Yes and no.
Depends what painful means.
Yes and no, because I got
No, it's not
I got a tube, I got a catheter, which is
Yeah.
not really painful. It's stuck in my chest, but some people have needles.
So I had a catheter, you don't feel anything, but then I had a tube put in, a fistula. It's been removed now. So they put, it's quite a big thick needle that they put one in there to take your blood out. And it goes through the dialysis, temporary, whatever the machine. And then the other needle goes in there where the dialyzed blood, the clean blood goes back in at the same time simultaneously. So putting the needle in can be painful, but they give us creams like Emla cream or whatever it may be, different hospitals, or sprays now, yeah. So you put that like half an hour, 1 hour before going for your treatment. It numbs that area, so a temporary anesthesia type or whatever it is. But once your needle goes in, you don't feel anything. I mean, sometimes, obviously if the needle moves, then you may feel pain, then remove it and do it again. But the blood flow as it is, dialyzing is not painful, you don't feel anything.
So my mother has a lot of pain from her dialysis. She hates it. She doesn't want to go. She's not suitable for a transplant, so it's keeping her alive. It's the only way to keep her alive. So, but she is miserable. Okay, so everybody's experience is different.
Yeah.
And one thing, she has to wake up at 5 in the morning to go to the dialysis, so she cannot sleep properly, very miserable, difficulty walking up the stairs, and then comes home at 12 o'clock, tries to sleep, wants to do the cooking and everything else, falls asleep on the armchair, wakes up, and not wanting to go for her next dialysis, okay? So everybody's different. So, but you know, it's there to keep you alive.
Is kidney problem hereditary?
It can be, yes, of course it can be.
Yes, Doctor, we know the dialysis could be uncomfortable, in some cases it may be painful as well, but it's like 2-3 times a week, going there, coming back.
3 times a week.
Yeah, it is a lot of hassle. The only treatment is the replacement of the kidney.
Yes.
Yeah. Is there any mechanical kidney or some sort of filter you can put there permanently?
So you may have some. So basically, dialysis can be done in the centre. Go there 3 times, attach yourself to the machine. I've got some pictures. Or you can have peritoneal dialysis, which is where you have a tube inside the tummy, and then you can do it at home 3 times a day. You put a bag of fluid up 3 times, sometimes once a day.
3 times a day.
3 times a day.
If you're doing it at home, you can do up to 5 times a week.
Yeah, and you also nowadays they're allowing some patients to take the dialysis machine home. Yes, hemodialysis. Yeah, hemodialysis. So if you have a family member that can use the machine, then you don't need to go to the hospital. The machine can be in your house.
So there's no mechanical...
Not yet.
There's no artificial thing
Not
that can
yet.
be put into my body to see
Not
if
yet.
it works
Not
instead
yet.
of a...
Still working on
You're
it.
still working on it,
We are
so
hoping something comes out.
future maybe.
I think 15, 20 years, 3D printers, they're printing kidneys. I think there will be something, inshallah. So let me just carry on. Thank you. I'm going to call you back up, folks.
Okay, thank you.
So I think that was very, very useful because looking at a slide is not as good as dealing with real people. So we've covered some of this already. Blood tests, urine tests. You need an ultrasound of the kidney and biopsy of the kidney, which is when the doctor puts a needle into the kidney with an ultrasound. We talked about that. I'm not going to go into it. So stages 1 to 4. What can you do? Lifestyle changes. How many people smoke here? Can you put your hands up, please? Anybody smoke? Very good. Okay, nobody smokes. That's great. Eat a healthy, balanced diet. Restrict your salt intake to less than 6 grams per day. Remember that number, 6 grams per day. Do regular exercise. Aim to do at least 150 minutes a week. I don't know if anybody can do that, but if you can, good. Lose weight if you're overweight or obese. Avoid over-counter drugs like Nurofen, Bruprofen if you can, and speak to a specialist before you take those. Dialysis. This is up to 3 times per week. You're often tired afterwards. You can get bleeding from the fistula. David showed you his fistulas. These are some of the bigger veins on the arm. This is the machine which attached to 3 times a week. And my mother's experiences, she doesn't have any ladies to talk to regularly. She'll sit there, they have a TV screen above, and she gets very bored. And maybe that's what, if you have a colleague or somebody to speak to, it makes it much more easy. And this is where West London Kidney Association, they provide money for things like TVs for people to look at, to take some of the boredom away from sitting there 3 times a week. This is where the tube goes into the tummy for peritoneal dialysis, so you can do it kidney transplant, we're just going to talk about quickly. The transplanted kidney, you don't always have to remove the 2 damaged kidneys. The transplant kidney goes in the groin, somewhere here, okay? And you have to be very careful with that kidney. The one thing Penny and Sarita don't mention is you have to stay on drugs to suppress the immune response while you're on those, and those can have their complications as well. Kidney transplant, a lot of misconception about kidney transplant. You can have it from a dead person, cadaveric transplant. You can have it from a living person. If you have it from a living person, the transplant is more likely to be successful than if you have it from a cadaveric transplant. The other benefit of the live donor transplant is that it can be scheduled at a certain time. The donor, who can be somebody who's matched with you, it can be a family member, it can be somebody who doesn't know you at all. There is something called an altruistic donor program where people just decide, I'm going to give my kidney to somebody, and they don't know the person. They do it. There were, I think, 250 in the UK last year, where somebody just decided, I'm going to give my kidney to somebody. I don't know them, I don't know anything, just kidney, okay? Then you can get it from an unrelated person, and there's various programs that you can use for the donor. 4 to 6 out of 100 patients will not survive their transplant in the first year due to complications from surgery, heart problems, the immunosuppression. So pleased, Rita and Penny, wonderful. Look at them, real wonderful, wonderful. From 2000 to 2010, living donor transplant activity in the UK trebled. There were almost 4,200 living donor transplants. 253 were paired or pooled transplants. That's when, for example, you may be wanting to provide a kidney to somebody in your family, but you're not matched. Somebody else is wanting to provide a kidney from a different family, but they match your member of family, so you swap the kidneys. Okay? That's one way of doing it. And nowadays, some hospitals, even if your blood group is not the same, they can still do the transplant. And you can have transplantation if you're having children, if you want to have children as well. Just some of the risk factors: smoking. It increases your risk. Nobody smokes here, mashallah, that's very good. This is something we should all know about, Asian diet. How many people love gulab jamun here? Or jalebi? Or big problem.
I don't like it. I don't.
You don't like it? Okay, very unusual. So I think one of the curses of the Asian community is mbala, or royal sweets. Even though we use them a lot. Please, I hope nobody knows anybody from Royal Mbala here. They will never give me a free jalebi ever again. So, daily healthy intake of calories for normal man is 2,500 calories. For a female, it should be 2,000 kilocalories. Now, if you look at 2 pieces of gulab jamun, and this is something I got, I didn't do the experiment myself, I've eaten a lot of gulab jamuns, but this was from the internet. 2 pieces of gulab jamun contain 300 to 400 kilocalories. Some people might eat 4 gulab jamun and ice cream, and maybe some jalebi. That's almost a third of your total calorie intake, just after your main meal. Okay, it's a lot of calories. I'm not talking, and one single piece of burfi is about 100 kilocalories. And, David mentioned, somebody asked David about what's he changed in his diet. I can tell you from an uncle who's passed now, unfortunately, he passed away, but he was he was addicted to sugar. Just like cocaine or heroin, sugar is an addiction as well. Okay, salt is an addiction, no different. So we have to be very careful. I was saying to one of my colleagues earlier, we as parents, we can be seen as drug dealers because we give our children sugar and sweets. We say, have some sugar, have some sweetie. We're no better than somebody in drug dealers because sugar and salt do more harm to the body than a lot of drugs like heroin. Okay, we don't see it so often. One samosa, very tasty. 250 to 300 kilocalories. Okay? What happens when you take too much sweet? You're at risk of diabetes, particularly type 2 diabetes. Okay? Type 1, which you're more genetic or born with, as many as 24,000 people died through diabetes last year. Okay? The risk of dying from it was 2.6 times higher than the general population. So diabetes, a lot of it is sugar related. How many calories? Is ghee healthy for you? Ghee, conflicting evidence. We use it a lot in Asian diet, but some studies say it's actually good if we eat natural ghee. Okay? Indian roti, we all love roti. My wife doesn't make roti, so I've never tasted roti unless I go and visit my mum in Glasgow, and she tries to feed me 15 rotis in one go. And this is why I come back a little bit heavier. One roti, 120 calories. Lovely curry, lots of salt. So we talked about high blood pressure. What's one of the main causes? It's salt. We all love salt. Asian cooking, my mother used to cook curry. It's very spicy. What do I need afterwards? I need sugar. I need something to neutralize the flavor of the curry because my face is sweating, my ears are burning. I need some sweet. And the burfi and the jalebi, we love it because we're addicted to it. We have been conditioned to like it. Is it good for us? No, it's not good for us, okay? Salt on chips, salt on everything. If you have cakes, it has salt in it. If you have bread, it has salt in it. If you have roti, it has salt in it. How much salt is too much? Basically, we're allowed 6 grams of salt each day. That's about 1 teaspoon. 1 teaspoon. Okay? One naan has 0.5 grams of salt. How does salt contribute to high blood pressure? It disrupts the sodium balance in the body. This causes fluid retention and increases the blood pressure. In the UK, 62,000 deaths from stroke and coronary heart disease would be prevented each year in the UK if all hypertensive individuals kept their blood pressure down. So again, salt. Not the only cause of high blood pressure, but one of the causes, which is preventable. Who loves Pepsi? Who loves Coca-Cola? Who loves...
When you talk about salt, human-made salt, is that the same? It's not the same as rock salt,
basically rock salt, sea salt, table salt, Saxa table salt, they're all as bad as each other.
Even the pink one?
Yeah, they're all as bad. I come from Scotland, so I think it's very popular. One can of Coca-Cola contains 38 grams of sugar. 38 grams. The Chancellor wanted to put a levy on drinks with more than 5 grams of sugar per 100 ml. So 330 ml can of Coca-Cola should only have 15 grams. It has 38 grams. How often do we go in the house and your family puts Coca-Cola or Pepsi? It's an addiction. Okay, it's an addiction, very dangerous addiction. What does this lead to? It leads to obesity. The UK is one of the top runners, getting bronze medal just now for obesity. Risks of obesity, one of them, kidney failure, lots of other ones. Mortality compared to salt and sugar, a lot worse than illegal drugs. So, how many deaths were due to illegal drugs last year? Heroin, cocaine, these drugs, 4,000 deaths in the UK. How many deaths due to sugar and salt potentially? 85,000. So which drug is worse? Okay? We don't want heroin, we don't want cocaine, we don't want any of those drugs. But the legal drugs can be more dangerous to more people. I'm just about to finish, Dr. Chair. So, the NHS has an Eat Well guide. Please read it. Please, for the older generation, somebody, as I was saying, I spoke to a 62-year-old man before I came here, and he was English, and I said, I'm doing this talk today. He said to me, the older people won't change their habits. They won't change their cooking habits. They won't change anything for you. You have to focus on the younger people. I want everybody, particularly the older generation who have more wisdom and who have more knowledge, to educate the younger ones now. Okay, you may not be able to change all your habits, but you have to educate the younger ones and change their habits. I am always trying to tell my daughter, don't eat this, don't eat that. It's difficult, but we're trying. We don't have Coca-Cola, we don't have any fizzy drink in the house. Water, that's all we have, water. And sometimes some diluting juice, but water. So please, educate the younger ones. MashaAllah, there are some younger ones here. My sisters, if you can educate as well, and be careful with the salt and the sugar in the food. You're the most important people in this equation in terms of diet. And that's all I have to say. Hopefully this has been useful. If anybody has any more questions, please ask. Thank you.
Asif, question from me is there any clinical evidence to sort of look at the benefits of fasting on the human, the kidneys? Because obviously everybody's fast 2 days a week. There's also a new diet. There's a new diet out there. There's a new diet that's called 5 on 2 off, 5 on 2 off, which is similar to what the Muslim diet is. Literally, you fast for 2 days, not on 5 days. I'm just wondering, is there any evidence to show that fasting is good or sort of not good?
I think the evidence is from my father, from what he used to tell me. He used to tell me that he was anecdotal evidence more than, I'm sure Dr. Jordi may be able to tell us more about the actual evidence. My father used to give me an example of an elderly man he's elderly himself now, but an elderly man who had various issues. He fasted And after the 3-4 weeks, the GP was amazed. The blood pressure had come down. You know, a lot of his problems were better. Now, from a water perspective, and Dr. Chaudhry gave a wonderful talk about water and the benefits of water a year ago, I think it was. I still remember it in Ealing Hospital. As a kidney stone specialist, water is very important to prevent kidney stones. So you have to be very careful if you're fasting and you have kidney stones to monitor how you take your water intake. But maybe Dr. Chaudhry can answer some of this.
Inshallah. What I would say is now, because we have just a couple of minutes for a call for the prayer, Adhan we call it, we can officially close the program. However, I would request our guests and Dr. Saab, if they don't mind, to stay around for at least half an hour until 3 o'clock. And so when people finish their prayer, which is the third prayer, you know, the Asr, Salat Asr, they can come back for 10-15 minutes time and ask question one-to-one. That will be more cozy and comfortable, because some of the ladies, some of the men have not asked question. So I'm grateful to Serena, Penny, David. I can't forget you. I apologize, I forgot you before, and I hope you forgive me. And Nushe, and also to our mosque committee. May Allah give you reward for that. And our organizers, Fahim, Umar, and if I missed anybody, please do accept my apologies. Latif Saab, Ayub Saab, Shaukat Saab, Shafkat Saab, and Ikram Saab. So I'm really grateful that our masjid is making a fantastic progress with a lot of similar sort of programs. We also have, I plan to do a couple more programs within the next 6 months. So inshallah we'll invite you, we'll advertise, and so people can benefit in the different sort of medical problem. So officially we close with the prayer that may God bless all of you, help all of you, give you cure and good health, and give you success in this world and hereafter, because we do believe in the hereafter. And I'm really grateful to you, but please do hang around for another sort of 20-30 minutes time so that people can personally ask questions. Jazakumullah khair. Assalamu alaikum. And there's one last thing I forgot. I am pledging £50 for the charity. I will encourage other people, if they want to donate anything, even if it's 5 pence or £1 or £5, if you wish to donate, either pick up the leaflet and make a donation online, or if you want to sort of, pay cash here, that's entirely your choice. It's your choice.
Thank you.
This mosque, the management committee will be sending donation to your charity, inshallah.
Oh, thank you.
Thank you.
We will let you know next week. We are having a meeting on 19th. We will discuss and we will decide how much we are going to give you, and we will send you.